Welcome to STEVELandray TV show, your #1 TV show in Delta State, Asaba. Yes, you guys, you're welcome. Thanks for joining us today. Today, we are really having an intriguing topic to discuss, and I'm not go dull. You know what I'm saying? All right, today I'm having our finest, you know, understand, the finest political scientist, you know, the person of Mr. Fidelis Anao. Mr. Fidelis, you're welcome.
Thank you very
You
much.
know, based on our last discourse, a lot of people were commenting about it, and I think I will be expecting some questions very soon. You know, so I said, for the topic we're going to be discussing today, I feel you are the rightful person that I need to call, because I feel you are the one that have the main thing to say concerning what we have to discuss today. And our topic for today will be on the puberty stage to those adolescents. I now discovered that parents nowadays, they are now deaf in terms of caring in that aspect, and the school at large too. I think they are not also putting enough interest in these children that are in this stage. So I would like us to have a broad discourse concerning this topic. So we'll be talking about. We'll start from. I would like us to start from the physical change. Then we'll be talking about the emotional and social change. We'll also be talking about the emotional challenges these children are facing that they can't say to their parent or their guardian in school. You understand? Then their health and hygiene level. You understand? Because in that part, I think some adolescents are not really good in terms of hygiene per se. They'll also be talking about skin issues. You know, because I believe that there are some reactions that do come at this stage too, and the parents are having deaf concern towards it. Then lastly, we'll be talking about resources and the support and guidance that you like to say. You understand? And advice, the kind of advice you like to give to this parent and school authorities to try to carry out. So what are your guides as a parent or a teacher towards the children at this stage?
Well, the puberty stage in child development is the most challenging stage during their development, because they need to relate with the parents, and at that level, behavior conflict at that level. So if the parents are not well matured, they may not understand them. So it is also very good for us to understand the meaning of puberty. Puberty is a process of development physically, emotionally, to a matured from childhood to an adult that has the capability to reproduce sexually. So at that stage, they are facing a lot of challenges, just as you said, starting from the emotional and behavioral perspective. Then you now go to the social identity issues. Then you now go to what we call mental and health issue. That another stage you face. And if at that stage you discover that if you don't understand them, you think they are becoming too stubborn, or if you don't know how to handle them at that particular stage, it becomes a conflict. between you and the parents. Now, the physical stage, which is the behavioral change and emotional change. You know, at that stage of development, the brain begins to produce some hormones that they can reproduce. And this can lead to a lot of anxiety. And that stage of anxiety, they have to have a kind of unpredicted behavior begin to come in. So at that stage, you need to understand them. Then at that emotional stage, these children tends to be autonomous. They begin to get closer to friends or peers than closer to the family. It is natural. So you must understand certain things that are natural, and that's emotional, or they are also driven by mood swing. That's sort of the result of the hormones. So they'll be driven by mood swing, change in behavior, change in character, a lot of things irritating them at that stage. And this stage is a stage from 8 to 13 years for female, and 9 to 14 years for male. It's quite challenging because at this stage now, they are in between adult and childhood. At that stage, they don't like to be called a child, and they are not adults. You know, at that stage now, you can see that without their mental understanding that we are not adults, we are not children, and they say we are children, and we are not children. Why would they call me a child when I'm not a child? Do you understand? And they are not adults. So it's a level you must strike a balance when training children. It's a level where challenges come in when training children in child development. Challenges come in at that stage.
Thank you very much. And our viewers, please, parents, guardian, whoever you are to these children that are at this level, this change, this puberty change, please, whatever it's your own take concerning what Mr. Fidelis have just said, please, you can drop your own opinion, your own idea concerning what you have just said now at this physical change. Now, Mr. Fidelis, my next question now is that what are the emotional challenge these children face at this stage? These are the emotional challenge, because sometimes you can see some parents will be shouting at them, "What's wrong with you?" I believe there is a time for this parent or guardian to understand that this child is having some emotional challenge or something like that. What do you have to say concerning that aspect?
Discussing the emotional challenge, as I said before, is a very difficult stage in child's development. The children will put us some behavior, abnormal behavior, that are driven by the hormones of the physical development. The girl begin to see breasts with social identity. The boys begin to see some hair in the pubic area. They begin to develop deep voices. A lot of development comes in that they begin to know that they are becoming a real man, and the same thing with women. So at that stage, everybody has emotion. So the way you handle them at that stage when they are children is not the way you handle them when they are at this stage. There should be what we call open communication.
Open communication is very, very important, because I think some parents these days don't do that.
By the time you don't do that, the children will look for answer.
And the answer might be negative.
They will look outside the family.
Yes.
They will go to their peers,
yes,
and get an answer. The peer will say, my dad told me,
yes,
my mom told me, my uncle told me, my aunt told me. The aunt may have a good intention or a bad intention. So if he has a bad intention, whatever you say, you say, you take it. I can also share a story because sometimes when we are discussing this in school or at home, some people say, I'm a Christian, I don't want to discuss this. Totally wrong.
Totally wrong.
There's this joke when I was much younger, when we are discussing puberty stage and we are discussing education, sex education. Then there was this story. It's a Christian family. Then one day the child just walked from school home and asked mommy, what is penis? Being a Christian home,
Yes.
the mom say, this child is getting spoiled.
She saw it in the other way.
It's getting spoiled.
Yes.
So you know, say penis. Luckily, there was pencil. Yeah, the dad was there. The gap was open. He said, that is penis.
Yes.
Pencil, penis.
Yes.
That's penis. There. The answer, the question has not been answered.
Yes.
This child have to go back to the peers in school and say, my dad told me that this is penis. This pencil I'm holding, this pencil is penis. Same to my. So the child took it like that. Then the child said, then I explained, the parents have to go further now.
Yes.
And I told them in that they use it to piss. It's where you use to urinate.
Yes.
It's, you know, that thing that you use for urination is the penis.
Yes.
They don't talk on the negative aspect.
Yes.
Then the child came back from school again and asked the dad, the parents, what is peace? Peace. In Nigerian language, peace is urine. And so that's say, what is peace? Not peace as peace like opposite of war. To peace in Nigeria slogan or slang. It's urine. He said, what is peace? Mother, the parents look at this child and say, we are from Christian home. This child is getting spoiled. Well, let's now look at that day. Fortunately, unfortunately for the parent, it was raining. Now say, look at outside there. Look outside there. That is peace. They now try to kind of balance the two information. Penis, peace. The child is going somewhere, and they were giving the child wrong information, wrong answers. So one day it was raining. Then their pastor came to the house with umbrella. As he was just want to get into the house, the child saw the pastor. He said, pastor, look at look. I think it was umbrella they even gave it, not pencil, sorry. It was umbrella they call pennies. I say, pastor, look at your pennies. The pastor, he said, which pennies? The boy was referred to umbrella. I'm sorry, it was not pencil, it was the umbrella they referred. And I say, you have to hold the umbrella, which the boy was thinking that what is dick. Then the pastor say, you see, the pastor don't look at the boy again. You see, his face is so that is the way the child could communicate to the outside world, because the parents were thinking Christianity is all about hiding secret.
And that's what I think is happening. 70% is happening now in Nigeria. It's happening this thing you just said now. I think 70 or 80%.
Yes. Christianity is all about hiding secret. It's all about reality. It's all about telling them the truth. Yes. If you're a Christian home, you have Islam home, you have to tell them the truth. When the truth comes, you have to tell them that. I could remember, if you see a story, imagine a boy that have not seen sperm and have not had a sperm before. He was lying on a bench and a girl was baiting, and he doesn't know that wasn't his intention. He now saw his trouser was stained with sperm.
Yes.
He will question, how come? I have not seen it before. I have not heard it. I have not heard about poverty stage. I don't know. I don't know that. I don't know that. I will produce sperm.
Yes.
Some of us pass through that stage.
Yes.
You don't know that. What is this? Is it akamu?
Yes.
Is akamu is pap? Already made pap in Nigeria. Is it akamu? So you begin to the same thing with girls that begin to have measles. Just as I told you, the parents, the mom have to be close. You know how to change pie. So we go and put tissue.
Yes.
By the time you put tissues, when you are during that period, you begin to stain particle. I'm discussing partly the health issue.
Yes.
Begin to be in there, and that will cause complication in the near future for the children. Say, where are the parents? Some don't even know how to dispose it.
Yes.
So we face challenges at this side. I begin to shout and say, are you dating girl? This is, I think we're going to discuss more of that when we get to the health issue.
Exactly.
So there are so many experiences that these children face at this stage. So that is having a kind of reflection or result on their brain, and that will affect the way you handle them. Because if you don't understand them, you beat them. I remember my experience as a school teachers. I see some female children will be sick, unnecessarily sick. Then I will see another female teacher say, "You say you are sick. Why? When you suddenly become sick, and we flog this child
On it.
But when I will question this child, I'm a male teacher. They're supposed not to tell me. Do you know that this female children say, my message, but Uncle Tess, Mrs. Stacy did not listen to me for me to explain, and I'm not feeling too strong because can you imagine that they relate with me and they trust me, they confide in me, so they could tell me I was okay, relax here. Maybe if that female teacher can say, please allow her. If it means calling the parents, I will do that. If it means that there is 1 or 2 drugs she normally takes whenever that occurs, you will say, okay, where is your medication? Continue. If you know what to do, you say, sometimes we ask, what do you normally do when it comes? They say, I would just like to relax and sleep. If I can relax my head on the bench, I will get myself. See, do you think if that teacher continue to flog such a child, the teacher will lose respect?
Exactly.
Because he's unable to balance the emotion with this child. These child also have emotion. They have feelings.
Exactly.
They have feelings. They are human beings. They are not aliens or animals. They are human beings. They have feelings. So you must understand, trying to catch their feelings is what you need as a leader or as a parent, as a caregiver.
Exactly.
You need that. You need to know, this person is passing through some challenges.
One thing I notice is that some parents or guardians, they don't have this patience.
Yeah.
I think if they should have this patience, they'll be able to understand or to sit down and listen to these children.
Yeah.
Whenever they are facing some challenges like this. And viewers in another era now, a lot needs to be corrected. This is 2025. A lot needs to be corrected. So we are at this puberty stage because I discovered a lot of things that is not going right. You understand? And these children, they need totally guidance, protection, support,
orientation.
Very, very important. You understand? Now, Mr. Fidelis, I would like us to be having advice immediately we are finishing any discourse, sub discourse per se. We should give advice. Now, what are your words of advice to guidance? These aspects of emotional challenge.
Before I will give my advice to parents, I would say like you to understand that one of the health challenges that the children face, like their body begin to produce sweat, heat, and when they produce this, they begin to have this a kind of smell, which if they cannot notice themselves. But so my advice, the parents need to be patient. As I said before, open communication. Like what I do with my students is what I call open communication. What is your problem? Why are you unnecessarily stubborn? What is going on? Why are you abusing your teacher? Why do you say you will not stand up? He said, Uncle, I can't stand up. I'm getting weak. At that stage, because I have emotion, something is wrong. Tell me what is wrong. So that is open discussion. And because I asked what is wrong, and they needed somebody to discuss with. They need somebody to discuss with, that will listen to them. So at that stage, they will listen to them. Another one for parents, you set boundaries. Yes. But as you are setting, very important. As you are setting boundaries, stay close to them. Exactly. See close to them. Set boundaries. Tell them what they need to do at the right times. You need to be home. You need to be in school. You need to be, as I told you before in my previous video, I said when it comes to children, it's triangular movement. Exactly. Triangular movement. Exactly. Children will give you an excuse. Yes. I want to go and copy notes for my friend after school. So what are they doing in school? Exactly. Yes. So what are you doing? Why didn't you copy it while in school? Exactly. Why are you copying your note late? Yes. After you come back from school, you have to go out again to another school. So that is also very risky. You set boundary, open discussion, and you are patient. These are just at all levels of the puberty stage, whether health issue, emotional issue, all together. These are the keys, the advice. Mm-hmm.
Thank you, Mr. Fidelis. One thing I would like you to see add to this is what are your advice to these adolescents that's facing this puberty stage, that's having this puberty? You understand? Like maybe when they are having mood swing, how can they manage the situation? What are your words of advice in terms of managing the situation they are? Because some children they are not opportune to be with their parents. Some are found being with their step parent or uncle, auntie, or some are homeless. You understand? Some are not in school. Some are just there. You understand? So what do you think is what can you say to encourage them not to miss it out?
For children at this stage, they need somebody. They need somebody that will be there to pull them through. Or if they are listening to this video, they also need that when it comes to certain things that they are at that stage now. So they need to manage society. They need to be very happy, and they need to be respectful even when they are facing those challenges. They need to be what they are, just be natural, manage themselves. Exercises also help for you to balance your emotion, but there's nothing like having a guide beside you that has been there, or else you'll be learning from experiences or from your mistakes.
Okay. Thank you, Mr. Fidelis. I believe with this little ones we've said so far, I believe our parents out there watching us now will really sit upright.
Yeah.
I understand. I'm really grateful. And now, speaking of hygiene and health, what do you have to say concerning that?
You can see that I give an holistic view of this puberty stage, then I touch that aspect. But we know that at that stage, the hormone will begin to produce certain gene coming from sweat, and the sweat will be offensive. And most of us know that the children will not notice themselves by themselves. It's somebody that is closer to them that will notice, and they begin to have boil and some things when they did not do the proper cleanup of their pants, their busters, their inner wears, their singlet, their bra. They are not those who wear too much tight bra and they don't wash it. And at times, I believe it can lead to breast cancer and the rest of them. You have to teach them, wear your bra once before you wear it again. Ensure you wash it. Don't wear it again 2 days, 3 days, 4 days. You discover that at that stage, your body, the hormones is producing something. And coming to meet any forms of death, we reproduce another thing. And that may lead to boil and some other things you don't expect in your body. You, for parents, you buy deodorant for them to look fresh. They should have their bed to at least twice a day or 3 times a day, in the morning and before going to bed, or in the morning when they come back from school and before going to bed. They have to take their bed, have a clean shower that will make them look fresh. And when you are looking fresh, you are looking more healthy. And when you are looking more healthy, you are looking more spiritual. And so that's it. Because if you are not looking, they say, according to the saying, cleanliness is the next to godliness. So if you are looking okay, everything is balanced. Your destiny is balanced. Your life is balanced. Balanced. And when you grow up like that, you see them grow like that. Just like some of the children will just jump into their bed without making their bed at night. Dress your bed, sweep your room in the morning. Do that at night. They develop that culture. They grow up to be, as I always say, responsible children.
Okay, Mr. Fidelis, thank you so much, and I think this is one aspect in this puberty stage that some parents are not really paying attention. For example, a female that is that just started seeing menstrual that is having a menses. Understand? You know, the first time there will be a shock. You might think something is wrong.
The same thing happened.
I would like you to give these children that are experiencing this stage of puberty, what are your advice or words of encouragement? Because, for example, now those the female aspect, some of the female now, their first experience having their menses, you know, they might be scared and they will think maybe something is wrong with them. When they maybe that first time when they experience that blood stain, they might be very very scared. You understand? And sometimes to the male, when they have what they call wet dream, you understand? They might think maybe they just urinate on their body, not knowing it's a sign of puberty. And I think that used to still happen to some adults, some adult men. You understand? So what are your words of encouragement or advice to these children that are having this experience for the first time?
My advice to them is to remove fear.
Yes.
Remove fear. This is normal.
Okay.
It's normal.
Now they hear it's normal. So don't be scared.
It's normal. You should not be afraid.
Yes.
And also is for us to let them know the challenge ahead.
Yes.
And to know the fact is that if your body reproduces these hormones,
yes,
and you are not in line with that your body, which means you are normal. You are not normal.
yes,
but you are normal when all those things occur. So for those who are matured, they are always happy seeing those signs.
yes,
But it's for our duty to let the children to also know who are now big children.
yes.
Because if you tell the children, say you're a child, I'm no longer a child. When I was a child, You see a girl of 30 years will tell, they say, he was telling a story where they say, when I was a child, I used to cry very well.
Yeah.
I used to take biscuit to school. Now that I'm allowed, I don't have to take biscuit to school. Yes. I'm not 13. Yes. So you see now, they want to belong. Yes. They want to belong. So my advice to them, you are all it takes to belong. Yes, you are all it takes. You are part of society. Yes. You are belong. You are now getting to an adulthood. Yes. They're just for you to show some respect, ask questions.
Exactly.
Ask your big mom, mommy, I experienced this. What is going? Ask questions. Be open to your parents. Yes. Don't hide any secret for them, because sometimes they might not be around or aware of what is happening to you. Just be open to them. So we have also advised parents to engage in open communication. Yeah. So it's your duty to tell your parents, this is what I'm facing. Don't tell your peers. Your peers may not even have the knowledge. Yeah. We know that at that stage, most of them want to look for question, and they want to have autonomy. They want to be independent. They want to go out to tell friends. They don't want to tell their parents. But your best friend is your best. Is your parents. Your best friends are your parents. Your best friend is your mom. Yes. And as a man, your best friend is your father. Yeah. And our children, they are our best friend. Exactly. I can confide in my mom. Yes. I can also confide in my dad. Exactly. Though I think they are in the best place or position to tell me the truth. Going to school, like the story I told you earlier, to ask your friends, what is this, what is that about human body. Yes. So it's not the best. Some teachers too, maybe good ones, you still have some bad ones. Exactly. So that might introduce the children to other things that are not in conformity with society's aims or demands. Because that's one thing. We are trying to train a better society by investing in these children.
All right, thank you, Mr. Fidelis. In addition, please briefly just add to your advice concerning, because sometimes at this stage you observe that these children, they experience skin reaction at this stage in terms of pimple, sometimes eczema, sometimes rash, aching, oily skin at this stage. So I don't know, what are your words of advice? Because most of them might be thinking maybe there's something really wrong with them.
Biologically, it is something that are bound to happen. So, but they need to be taught personal hygiene. Okay. Personal hygiene, like tell them how to keep their laundry, when to wash their clothes, how to package their wardrobe, how to make it air to come in, how to close their wardrobe, how to not to wear clothes, dirty clothes, or not to repeat clothes that is not washed, because some skins are very sensitive. That's the right voice. And if you keep that at that stage, it's no longer the child you used to be. You are now an adolescent. You are now moving from a particular stage, and that is a period of transition from childhood to adulthood. But there is a middle or a gap in between that we need to manage together as parents. You manage it with us, and you as the growing child managing with us. The growing adults, because they don't like to be called children.
Thank you very much. Thank you very much. Nice to have you on STEVELandray TV show.
Thank you very much.
I will call you next time so that we can wrap it up perfectly well. Thank you very much. Please, your comment is very, very necessary. I will see you next time. Thank you very much.